The Comprehensive Fetal Care Center here at Dell Children's Medical Center is a center that was established coming up on 5 years now to develop an idea about the fetus being a patient. And so it can be related to a diagnosis of a birth defect. It could be related to a condition that the fetus needs treatment for. So everybody has an ultrasound at 20 weeks. The baby's big enough to see everything. And it's there that unfortunately a pregnant woman thinking everything is okay is told her baby has a birth defect. And then that patient, many times from the OB's office, will be sent to a maternal fetal medicine's office who will confirm the anomaly. And then based on the type of anomaly, will refer to us for delivery here at the SDU.
I think what really sets the Fetal Center apart here at Dell Children's is that we really have a team collaborative within other subspecialties. So if a patient is coming in and it's determined that they need to see, fetal cardiology, they need to see urology, surgery, and a host of maybe other specialties, that's all in-house. So the patient doesn't have to travel anywhere. And I think that that creates a lot of convenience, and it's part of that patient experience. With the amount of times they'll have to come in for their appointments, it just makes the process a little bit more seamless, and they really get to know their entire care team.
We do spend a lot of time with our patients because they have very complex diseases and complex diagnoses that require a lot of counseling, especially when I'm sitting down in that initial appointment to make sure they fully understand what's going on. They understand the process of how their care is going to go with us. The majority of the feedback that we get from patients is that they don't feel like a checkbox. They feel like we've sat down, explained it to them, spent the time with them, and make them feel like they are in charge of their care and that they understand their care too.
We have a social worker trained in perinatal mental health who meets with every patient at the beginning. And she even takes on some of these patients in counseling. We have a psychologist and we have a psychiatrist who can provide medication if the patient needs that to get through its difficult time.
What's cool about my role is that I provide embedded support. They're not referring out for therapy. They are able to just get it in-house. And therapy is hard to come by. At their first appointment, we talk always about how this is really hard for a lot of moms, and it's understandable if they need a little bit more support during this time.
Our neonatology team is also embedded within the Comprehensive Fetal Care Center, and they work very closely with our nurse navigators and our entire care team as we start to talk about delivery plans and aftercare for the baby.
A nurse navigator is a registered nurse who helps patient from the time that they get to whatever specialty, in this case would be fetal medicine, helps them navigate their care until the end of their care. So in this case it would be delivery. And I also help to connect them with the different specialties that they'll need to be in contact with, such as like NICU, palliative care, that may follow them even after delivery, may follow the babies.